Good morning, everyone. Greetings from San Francisco. Synthetic data in dermatology. Lack of data is not the limitation anymore. Super happy to be here, World Symposium 2024, Digital Health in Dermatology. My name is Dr. Yudara, and I'm a consultant, emergency physician, and AI scientist engineer. Okay, let me take a pause here. Since this is a technical lecture, I'll share a little bit about myself. I'm a consultant physician for 15 years. Plus, I'm an engineer, which I started my engineering career way before. I started coding when I was 10, continued all the way. And 2022, I thought the way forward is combining these two hats and then start my startup journey in HeHealth. So now I left the full-time medicine, practice as an engineer more or less. Continue to build technologies. I have multiple patents under me in technology side and leads two companies. HeHealth Inc. is a San Francisco US-based company focusing on sexual health. And of course, moving to Agee, Agee AI is a full spectrum AI product development company in Singapore. Again, super happy to be here. Let's jump in. And if you have not seen my previous lecture, please go back and see it. I give a talk on artificial intelligence in sexual health, the HeHealth story, and how we started and how the technology grew and so on and so forth, why the limitations. So if you have not watched, go back, watch it, and come back so that it will be much more meaningful. But if it's not, for technical purposes, the synthetic data people who are interested, enjoy. And when I started HeHealth, as I mentioned, HeHealth is a sexual health company where we build the world's first STI detection system using AI. Of course, we were collecting penis pictures to build this data set, and it was not easy. So one of the biggest projects, biggest hurdles we faced is lack of data. And we look at it, there was nobody else have done this, and we were quite shocked. And then we soon realized why is it we need large amount of data, proper label data to do this, and there was not enough data, and it's not easy. Nobody wants to share their penis pictures. So that's where we thought about synthetic data on the day one itself. That's 2019. So what I'm going to do is I'll walk you through our journey in the HeHealth and new brand SynVision and how we did it, and then looking beyond where the synthetic data going through. So again, coming back to HeHealth, we built the world's first STI detection system for visually recognizable symptoms through AI. As simple as if you see something which you are not sure on the penis, take a picture, upload it, answer a few questions like when is your last sexual contact, is there any other symptoms like discharge, pain, so on and so forth, and AI will be able to detect and tell you the personalized information which is likely the case you're having. And not only that, we will be able to guide you through the process. So it is very accessible anywhere in the world. As well as you have internet connected phone, you can get the help, and it's accurate. From WHO report says doctors accuracy is roughly about 50% in clinical diagnosis of STI. We are hitting about 94% already, and it's affordable. STI test is very expensive. That's why WHO suggests syndromic management, but we know syndromic management personalization is very poor. Solving both problems, we have a very low cost. It costs only $0.1 for us and can deploy it in population level and solve the limitations in syndromic management. And not only that, through this in California, we have launched a full spectrum clinical services. That means detecting and screening, connecting to the doctor within 24 hours, getting treated and sorted out, all in super fast way. Again, this is in detail in the previous lecture. Go have a look at it. But again, coming back, so to do that, we need to have large amount of data. So again, as I said, we start using synthetic data from the beginning, and then we build the first MVP. Then I have another problem. So when we tested the dataset in the validation side, we realized the brown skin or black skin have a significantly lower accuracy compared to the white skin. Of course, we started the project from US, so we had a lot of US white skin data, and clearly it was having a bias towards the darker skin tones. And I, as a brown skin CEO, I was like, no, I'm not going to accept these results. So if my AI is biased towards my own self, I'm not going to accept. So we build synthetic data from the day one to augment our data sets so that it's not having any bias or lower accuracy compared to the white skin or fairer skin in the models. That's how we started. But let me come back to a little bit of basics on the data side, data barriers. And of course, as we explained through the HeHealth, lack of data is one of the biggest problems. And bias, we talk about it from my own personal experience. And one of the other biggest problems is the privacy and legal restrictions. When you're collecting data, storing data, you have to follow a lot of restrictions, especially for us in US, you have to follow the HIPAA, in US GDPR, and of course, you need to get the consent, the data anonymization, standardization, and data security, sharing compatibilities. If you need to do a cross-cluster like different hospital or different university validation, how are we going to transfer it? Lots of limitations. And of course, with these limitations, traditional data collection is not really scalable. When you're building like us at HeHealth, building population level models, you need to have a way to scale faster, but traditional way not really helping. And that's very obvious if you look at it. Most of the companies, there's this report talks about 96% of the companies who are building on AI side complaining lack of data or data bias. 96%. Let me take a pause. 96%. I'm pretty sure everyone who's listening to this lecture will agree with me. Not 97, almost 100% people have problems with lack of data and bias. And let's touch on a little bit what is synthetic data and why is synthetic data. Synthetic data is basically not actual data collected from the patients. These are data generated from the computer technologies. Usually there are two types of it, what we call text or tabular data. That means like clinical notes, clinical charts, and so on and so forth. And what our specialization in mostly is the images, the visual data. When you see a rash, you take a picture. When you have a chest cough, you take a chest x-ray, which is an image, CT, and internal body, for example, colonoscopy. These are all image data. And of course, we know image data captures more data than text data. And why is synthetic data? Of course, we already use gold standard anonymized data collection methods. But again, as we discussed in the previous slide, it's not so easy. You have to go through so many hurdles, and even with that, we might not be able to get enough data to train the models. And then what's the difference of anonymized data versus synthetic data? I'll give you an example. So if you have a rash, and when you want to take that picture into training a model, obviously we want to make sure that this face is not recognizable by anybody else. So what we do is we usually cover the eyes and parts of the other recognizable things. But when you cover these important parts, the machine actually not able to learn the full picture. So that's a massive problem. So this belongs to the rest of the body parts also, and it limits our progress and accuracy. So, but if you use a synthetic data means this data doesn't belong to anybody at all. And then we can use the whole face plus the rash so that you don't have to worry that people will be able to recognize this face because it's nobody's face. So that's the value. Actually, a lot of people don't realize it yet. Synthetic data is much superior than the anonymized actual data. And it has proven by our results, which I will share you later. So when we first started in the HeHealth journey, what we realized, we have lacked data, but technology was not mature enough. And we need more variations. Remember that brown skin bias? So what we did is we actually cut and paste things using Photoshop in 2019 and used them to augment our brown skin data sets. Actually did help, believe me. And then what we did is technology starts growing. There was this technology called generative adversarial networks, GANs. In 2020s early, we started using GANs, which is far more superior than Photoshop, and it was giving new variations And then, of course, since last year late, we moved to stable diffusions. That's where the magic comes in. Those things can create amazing, hyper realistic images in healthcare. Let's take a pause here. Appreciate this beauty. Okay, let me see who knows this lady. Her name is Lexi Schmidt, 22, old fashion model, super famous in social media. She's from Germany. And she do share her images when she's going into holiday in Alps, watching football matches, when she's going to work, as usual. But let me tell you something which is mind-blowing. Oh, by the way, she was one of the finalists in recent World pageant. And let me tell you, this person is not the actual person. She's a complete synthetic model. That means her image is generated in a computer. There's no one actual person who's living, but in a digital realm, she lives very real. She goes to football matches, she goes to hiking, and so on and so forth. And millions of people are following her. So this is quite mind blowing, right? So if you think that this is almost real, why can't we use these technologies to the healthcare? That's where we came in. Actually, we have a complete new brand called SynthVision, which we are generating complete image-based healthcare data synthetically, and we can actually generate images. All the pictures you see here, chest x-rays, CTs, skin rashes, colonoscopies, endoscopies, retinal images, every single picture is generated synthetically using computer GPUs. We can do dermatology, radiology, histopathology, endoscopy, ophthalmology. And the beauty of it is that when you create synthetic data which does not belong to a patient, we do not have to follow their privacy protocols. And application can be very broad. And of course, as I said, it actually most of the time perform better than the actual patient data, because these are standardized. The lighting is controlled, color is controlled, and so on and so forth. And of course, cost saving, if you look at it, collect the data in a developed country, it costs a lot of things, and this can be cheaper. So let me touch on the benefits of these things again a little bit more. So it mirrors the real world accuracy, but it doesn't have the real world biases. So we can control the bias and make sure that your data does not have bias. And of course, you can just tell us how you want the data. We can customize. In the next slide, I'll show you. This is going to blow your minds, but we can control all the single parameters. And at the end of the day, this data is yours. So you can decide what you want to do, where you want to do, how you want to share, how you want to manipulate it, whatever it is. So that's the beauty. So when you want to do R&D work, this is the best case scenario. Again, let me show you. Look at this data. So when it comes to skin conditions, we can generate any kind of skin color, lesions, body hair, lighting, you name it. So some of these things, eczema and different kind of skin conditions, we generated completely on demand. We decide where's the place, how severe it is the rash, and whether there's any extra features like hair, and so on and so forth, and we can generate. So we are able to actually mirror the actual society variations very, very accurately right now. Let's move. I know it's too good to believe, but let me show you some use cases. Okay, this is one of our most proudest moments. It's carried forward from HeHealth. Again, as I said, when we decided to use synthetic data, lots of media and scientists, doctors around question my method. So initially, of course, we didn't have enough scientific proof, but we recently published this paper with Harvard School of Public Health and University of California, Southern California, USC. And we are the first to demonstrate this. We built the HPV viral wart detection model using 100% synthetic data, and that model outperform any available models which is using actual data when it comes to accuracy. I let it sink. And all the images you see in this slide are synthetically created. I actually sent these images to more than 10 venerology, dermatology professors around the world and asked them to grade what are synthetic and what are not. They all got wrong. Nobody managed to recognize 100% what are the synthetic images or not. And this is quite interesting. So this is the first case we have actually demonstrated and showcased that this is possible. Of course, we are not saying we're going to move everything to synthetic, but synthetic data is a powerful tool when it comes to lack of data and data bias. But we show it, you can even do full synthetic. And let me touch on this a little bit more since we have time. So if you look at this, we can actually create a different variations of it, like classical coliform things which is in the brown skin, which are near the glans penis, which are very subtle, and so on and so forth. Early stage, late stage, you name it. And of course, we have something called variation mapping. So with that special mathematical formula, every single disease, we create a way that all the different variations and distributions are really mapped, and we create the data representing those things, mirroring those things. Yeah, I'm writing this paper called random variation and selection theory. So this way we are explaining in detail how we create this mathematical model which can replicate the actual life or actual population level data. Let's move to the next one. Okay, I'm only sharing this in a medical conference because otherwise it can be very intimidating. So one of the famous NGO, non-governmental organization, reached to us and asked, is there a possibility that we can create the HPV viral ward detection model for specifically for MSMs in this case, because they have a higher risk for anal cancers and lots of people not able to detect it, and this in a way that we can promote the HPV vaccination. In a traditional sense, this would have taken few years to collect the data because it's so sensitive. And of course, again, to remove the bias, we need to have different segments of the society giving the equal number of. This is almost impossible. Imagine the impact, the effort we need to put in. But with the Syntuition image generation model, we created a very diverse image dataset in 2 weeks and trained a model which have a 97% accuracy in the multi-class classifying model to detect HPV in the anus for this specific community. And look at these images. Every single image is synthetically generated. It has different skin colors, different hair contextures, different variations of the HPV. Honestly, we are living in an exciting time, and I'm super proud to be the team lead of this work. Beyond the dermatological implications, so applications, let me tell you a little bit what are we doing right now. Under the Synvision program, we are developing technologies even for radiological images, as I mentioned before. So we had this use case recently. One of the companies built a breast cancer detection model for mammography in Singapore using a American data set. When they tested, they realized that Asian breast is actually denser and the shape is different, and the model performed very poorly for Asian breast. They come to and ask and said, can you help us to augment the dataset, specifically mirroring the Asian breast shape and the density? We did that, and then the model managed to improve 20% accuracy in the Asian breast to detect the mammographic features of the breast cancer. So we are ultra proud of work we are doing, and again, we are living in a crazy time. Again, the last part. In my previous lecture in the sexual health, AI and sexual health, I talk about a little bit the next pandemic possibly having dermatological cutaneous presentations and how we're going to face it. So I think it's very important. During the COVID, we realized it took years to understand and build models for disease detection. With our paper, go and have a look. You can QR code scan here. We discuss using synthetic data to build new disease detection models in as short as 2 to 4 weeks, completely synthetically. This is mind blowing, honestly. Not because it's my work, go have a read. We are in a time where we can actually build models very fast. And that's it, guys. Again, this is something very passionate to me, and I'm super proud of what we're doing in Intuition and HeHealth. If you are interested to bring in these technologies to your work, please do reach to me. You can scan the QR code. You can find me in LinkedIn, which is my preferred way, or you can drop me an email or text WhatsApp also can. So again, it's my pleasure to deliver these two lectures. Please go watch both, and do reach to me if you have anything. And have a lovely day and enjoy the rest of the lectures. Thank you so much. Bye bye.